Thanks for coming in on a grey Monday morning in London. So welcome everyone. Welcome everyone also joining online. Just a quick reminder for those joining online, I've got my little tablet here, so any questions you have in addition to those that may be coming up from the audience here in London, if you've got questions you want to pose to the panel members, then get writing and they'll pop up on my tablet. So before I introduce myself and the other panel members here in London and joining online, I guess we should do a couple of quick housekeeping things. You've all come in through the main entrance. So if the fire alarm goes off, that's the best way of getting out, but there's also another exit just out here and over there to your left. So that's if someone hits the panic button, but that's not going to happen. So let me introduce everyone first. So my name's Roger Kalo. I'm a senior research fellow at ODI, currently on leave in Shanghai, but back especially to chair this fantastic event. On my left, let's do the ODI bits first. We have Dr. Eva Ludi, who joins me from the water policy program here at ODI, and Eva's now head of program. Immediately on my right, we're doing the London bits first. We have Oliver Cumming from the London School of Hygiene and Tropical Medicine. And I'll introduce these folk in a bit more detail when their presentations or their reflections actually come up, but we're just doing this quickly. On my right, on my far right, Tom Slaymaker from UNICEF in New York, and then joining online, and a warm welcome to Dr. Caliste Tindimugaya, Commissioner for Water Resources and Planning and Regulation, Ministry of Water and Environment in Uganda. And also joining from Lusaka, I think we have Chilufya Chileshi, Regional Advocacy Manager for WaterAid. So quite a big panel today, so we need to be clippy as we go along and keep everyone on time. But I don't know why I'm telling myself as chair as what I need to do, but that's what I'm telling myself and the other panel members. So the subject for today's event, why have we chosen to major on equity in WASH, or achieving equality in water and sanitation? I suppose the main reason for that, and one that many here joining online will be familiar with, is that despite the successes of the MDG, the Millennium Development Goal period, where, of course, the international community hit the water target but missed the sanitation one by a long way. So despite the successes in terms of galvanizing political commitment and increasing the numbers of people with access to improved services, we have these glaring inequalities that remain. Inequalities through geography, different areas, rural, urban, hard to reach, easier to reach. Inequalities via group characteristics, so ethnicity, for example, and inequalities via individual characteristics like gender and age. So the SDGs marked a much more ambitious attempt, I think, to achieve universality, and that equity or universality rubric runs throughout the goals of the SDGs, all 17 of them and 169 targets. That's a lot. So today we're going to be talking mainly about Goal 6, ensuring availability and sustainable management of water and sanitation for all, the universality bit, by 2030. And that's a much more ambitious target with implications for financing, ways of doing business, prioritization, and so on and so forth. So we're going to be talking about some of these issues today, and we've got a very good panel, I think, for doing it. So without further ado, let's turn to our first speaker. So we've got 2 speakers and 3 more of a discussant role. And just to remind you all, we'll open things up to discussion after we've heard from the speakers and the discussants, and that reminder includes those people joining online. Okay, so first on my right we have Tom Slaymaker, joining, as I said, from UNICEF in New York, now shuttling backwards and forwards, I think, between the UK and New York. So Tom is familiar to some of you, I know, because he used to work here in WaterAid, he used to work over there in WaterAid, used to work here at ODI, in fact. Tom is a senior statistics and monitoring specialist in the data and analytics section at UNICEF in New York. So almost 20 years experience working on water and sanitation, mainly Africa and Asia, and currently co-leading the WHO UNICEF JMP, Joint Monitoring Programme, that some of us are familiar with on water supply, sanitation and hygiene. So Tom's going to kick us off with a quick overview. Over to you, Tom.
Okay, thank you, Roger, and thanks for the introduction. So I work at UNICEF, and together with WHO, we're responsible for global monitoring of progress on drinking water, sanitation and hygiene. I also co-edited a book with Ollie Cumming on equality in water and sanitation services. So what I'm going to do is I'm going to give an overview of the extent to which the global monitoring framework is tackling inequalities, and to highlight some of the issues that emerged from that book. So as I think you know, the 2030 Agenda for Sustainable Development is extremely ambitious. 17 goals, 169 targets, and now around 232 global indicators. And the important thing, I think, to recognize when we look at this agenda is just how ambitious it is, how complicated it is, and the extent to which these different objectives relate to each other. So whether you're interested in water and sanitation, or whether you're interested in education or health or education or nutrition, each of these goals and targets are interrelated. And a big part of this agenda is trying to promote a more integrated approach to development, bringing together the social and the economic aspects with the environmental targets. But when it comes to drinking water, sanitation and hygiene, there was a fairly strong consensus going into the formulation of this agenda around the goals for the sector. One was, firstly, to eliminate open defecation. Another was to try and achieve universal access to at least a basic level of service. And the third was to progressively improve the quality of services that people are getting. And you see that reflected in the global targets and also in the global indicators. So I'll just give you a quick overview of what those are and what we are now monitoring. So previously, for the MDGs, we were monitoring the population with and without an improved drinking water source. But now we're subdividing those categories further. So we still make a distinction between improved and unimproved, and also the population using surface water. But if you have an improved source, we now make a distinction between an improved source within 30 minutes and an improved source beyond 30 minutes. If it's within 30 minutes, then that will count as a basic drinking water service. And that's more ambitious than the old MDG indicator. But at the top of the ladder, you have this new indicator, which is reflecting the full ambition of the targets. And that is drinking water from an improved source that is located on premises, available when needed, and free from contamination. So 3 new criteria relating to the quality of services. And this, of course, is much more ambitious. So safely managed drinking water is a subset of basic. And as you see, globally in 2015, while we had 89% with at least a basic level of service, once you take into account these additional criteria for safe management, then it comes down to 71%. We have a similar logic with sanitation here. We still have a strong focus on ending open defecation at the bottom of the ladder. And we're making a distinction between use of an improved sanitation facility, which is shared with other households, and an improved facility that is private, which will count as a basic service. But we're now going beyond access to a toilet facility and looking at what happens to the excreta. What happens when you flush the toilet? What happens when your septic tank or pit latrine fills up? So a safely managed sanitation service is an improved facility. It's not shared with other households, and it's where the excreta are either safely disposed of in situ or they are removed from the household and treated off-site. So for our baseline estimates for 2015 for sanitation, you can see 68% with at least a basic level of service, but it drops right down to 39% once we take into account the management of excreta. We still have 12% there practicing open defecation. That's 892 million people globally still practicing open defecation. And then for hygiene, this is new for the SDG agenda. It wasn't included in the MDGs, but we're looking at hand washing facilities with soap and water available in the home. We have the same concept of a ladder with and without soap and water, or no facility at all. But importantly, we can only make these estimates for around 70 countries. And when you look at those 70 countries, you can see what a very wide range we have in terms of coverage. And of course, in sub-Saharan Africa, very, very low levels of coverage with a basic hand washing facility. So this was our baseline status going into the SDGs. And it gives you a sense of the scale of the challenge ahead. But on top of that, the 2030 Agenda emphasizes this concept of leave no one behind and requires that these indicators be disaggregated where possible, where relevant, by a whole range of different stratifiers. And we have this concept of, as we progress towards universal access, also reducing the gap between advantaged and disadvantaged groups. Whether that's by age or sex or ethnicity, migratory status, geographic location and other characteristics. And I think we've made quite a lot of progress in highlighting some of these inequalities. These are examples of inequalities in basic drinking water, sanitation, hygiene and open defecation. And we can zoom in from left to right between the global situation, the regional coverage and then individual countries. So for drinking water there, you can see that Angola is towards the lower end for basic drinking water coverage within sub-Saharan Africa. But if you zoom in further and look at coverage in urban and rural, you can see a big gap. But the biggest gap is between the richest and the poorest. So over 80% of the richest have basic water services, less than 20% of the poorest. And a very big range when you look at subnational regions. We see the exact same pattern for sanitation in Panama. In Panama, the difference between Panama City, 100% coverage with basic sanitation services, less than 1% in Gunayala, which is an indigenous district in Panama. Bangladesh is famous for getting close to eliminating open defecation, at least if you look at the aggregate figures for the country as a whole. But when you zoom in further between the richest and the poorest and the subnational regions, you can see that in some parts of Bangladesh, coverage is still only at 80%, not practicing open defecation. So there are a number of different dimensions of inequality which we're now trying to take account of. The environmental dimension is extremely important, and Roger wrote a chapter in the book looking at this, emphasizing the importance not just of the quantity of water available and the capacity to manage it, but also the quality. And this is particularly important in urban areas, rapidly urbanizing areas, where we have enormous pressure on water resources. And that's why we have, under Goal 6, a number of other targets that go beyond drinking water, sanitation and hygiene and start to take account of water resources management, ecosystems, wastewater treatment, and so on. There's also a very strong focus on gender. This is partly addressed through the time taken to collect water from distant sources, and you can see here some recent data from Sierra Leone, where we still have 33% of the population spending over 3 hours collecting water each day. and a further third of the population who spend between 1 and 3 hours. So a very significant problem, and it's overwhelmingly the women who are responsible for drinking water collection. But there are a number of other aspects of inequality which have a very strong gendered aspect. We're also increasingly looking at disability. These are some data from a recent assessment we did of schools, looking at the proportion of schools which have an improved sanitation facility and the proportion which have one which is accessible for students with limited mobility. And you see a huge drop in many of these countries between having a facility and having one which is accessible for those with limited mobility. And this is common across the board, whether you're in France or you're in Fiji. Another really important aspect of inequality is inequalities beyond the toilet. Previously, we've been monitoring the population with and without an improved sanitation facility. But once we started to take into account those that are using sewered connections and those that are using on-site facilities, we see that globally we have roughly the same proportion using those two different types. And this has fairly profound implications for how we are managing sanitation and managing excreta. And the focus of efforts in different parts of the world. So if you look at the different regions, you can see in sub-Saharan Africa, the vast majority using on-site sanitation systems. If you come through to North America and Europe, then the majority using sewered connections. So this has implications for financing, but also implications for cross-subsidies and the way in which we imagine different population groups being served in future. So as we progress towards these targets, we can start to benchmark countries and see their relative rates of progress. If you look along the bottom here, you see coverage of basic sanitation services. And up the side, it's the annual percentage point change per year over the last 15 years. And so in order to achieve universal access by 2030, depending on your coverage, you will need a different rate of progress. And so the 14 countries in the green are on track. They either have a high level of coverage or a high rate of change, or both. Those in yellow are currently progressing too slowly, and some in orange, which are below the line, are actually regressing for a number of reasons. In many cases, services are not keeping up with population growth, particularly in urban areas. So a number of different ways of thinking about inequalities and very significant implications for the way in which we design policies and programs to address them. But one common theme throughout the discussion that we had around the book and the discussion that is going on in terms of implementation is the extent to which these inequalities are interlocking and overlapping. And so those disadvantaged groups are very often not only disadvantaged when it comes to water and sanitation, but also in terms of healthcare, in terms of nutrition, in terms of education. And so understanding how we can identify and target those groups, but also how the investments in one area are essential for progress in other areas of the 2030 agenda, I think is a common theme which is we're going to keep coming back to in the discussion on the panel. So, Roger, I think I'll leave it there with that initial overview. Thank you.
Fantastic. Thank you, Tom. That's a great start. Just to pick up on your last point, the interlocking inequalities, I think that was something you wrote about, in fact, in the book, right? And also, raising the issue of water quality, having just, come from China, a lot is written about China in terms of water scarcity, particularly in the north, a country that's achieved fantastic things in terms of basic services, but it's water quality actually, which is the big knotty problem for government. Once you've got a problem, it's quite difficult to do something about it in terms of remediation. So many thanks, Tom. Pushing on. I'm going to bring in you're called guest one on my screen here, Caliste. But thank you very much for joining. Let me give you a quick introduction for the benefit of the people here in London and others joining online. So, a reminder, Callist is Commissioner for Water Resources Planning and Regulation, Ministry of Water and Environment in Uganda, a job he's had there since 2007. So he's responsible for planning, allocating and regulating water resources. So Callist started his professional career in 1919, became head of the groundwater section in 1999, responsible for all groundwater management activities in Uganda, and certainly in sub-Saharan Africa we know that it is groundwater development and management which really is going to underpin attainment of that drinking water goal, just to pick that one out. So, Callist, over to you.
Thank you very much, Roger, and good morning, everybody. Greetings from Uganda. It is afternoon now. I hope the weather is good right there. I will be giving Uganda's perspective as requested. Of course, for Uganda, we do recognize that the equity agenda is very important for our country, like it is for many other countries. We do note that access to water, sanitation, and hygiene services are key in poverty reduction, economic growth, and livelihood improvement. And we also, as a country, do recognize that when we talk about water, water supports different socio-economic activities, and when we are looking at, for example, water supply, we need to look at it within the whole spectrum of other uses. As a country, we are currently trying to move from our status as a low-income country to a middle-income status, and water is becoming very, very important in this agenda. And we are trying to see how best we can have access to water improved. We have had challenges in the sense that in some areas the water is not available, but in some areas it is too much and it causes problems. So we are trying to see how we manage this variability of water resources so that we can take advantage of it. We have, for a great extent, depended on point sources of water, for example, boreholes, hand-pumped boreholes, springs, shallow wells supply water to our people. But because of these kind of pumping technologies or delivery technologies, sometimes it becomes difficult to reach certain groups of communities. If you are very far from a borehole, then obviously you have to walk for a long distance. If maybe a spring is not available, then you don't access water. So as a country, we are trying to improve water supply coverage by changing from hand-pumped boreholes to solar-pumped boreholes. And we do believe that through that we'll be able to reach people where they are rather than actually people walking for a long distance. But also we are trying to use these schemes not only to supply water for drinking, but also to supply water for other purposes. So as a country, we are moving into multi-purpose uses of water. Right now, when we develop a scheme for domestic water supply, we want this water to be used for other activities like micro-irrigation so that people can get livelihood and be able to get the money actually to pay for the water. And we also do believe that even if you provide safe drinking water to somebody who is poor, you have actually not helped him much. So we want to improve access to safe drinking water while also improving people's livelihoods and incomes so that they are able to develop holistically. Micro-irrigation in the country is being given a lot of attention, and we do believe that if people don't have access to food, then obviously we shall not be talking about holistic development. Again, we are looking at water coming in to support, and I think as Tom has highlighted, when we are looking at the targets we are trying to achieve under SDG 6, many of the things we do will have implications for other goals. So again, we need to recognize that whatever we do in water, because water supports many activities, as we know, and you cannot really focus on goal number 6 without looking at the broader picture on how delivery under goal 6 will impact on other goals. Within this framework, as a country, we have recognized that we cannot continue looking at provision of wash services without looking at the overall water resources management framework and indeed general environmental management. We have developed a policy as a country that all water infrastructure projects have to be implemented within the framework of a catchment. We do recognize that in many areas, schemes are put in place, but the water is not available after some time. So we want to put in place infrastructure, but we protect the catchment so that the water continues to flow in adequate quantity and quality. In Uganda, we have this saying that you cannot continue milking a cow if you don't feed it. So we do believe that, again, you cannot continue pumping water or delivering water if you don't look at where the water is coming from. Within that framework, we have actually developed what we call water source protection guidelines, which require that every water infrastructure project, as a requirement, has to put up 3% of its budget to protect the catchment. It's now a licensing requirement, it's a legal requirement. When you design a water supply project, you have to have a budget for water source protection. And it has been agreed as a country, and there is nobody who is actually really questioning that. But we, of course, need to remember that whatever we've been doing, we have actually been having inequalities. As a country, access to safe drinking water right now is about 70%, and access to sanitation services, sanitation services is about 79%. Now, we note that although we're having this broad picture for the country, there are many, many inequalities. We're having some districts which have as low as 30% water supply coverage, others having as high as 99%. For sanitation, the same situation. Some even go as low as 20%. So again, when we report progress and we ramp that progress, we have to disaggregate this data so that we can know that we have inequalities across the country. We're even also having inequalities even within the district. As a result, we have been directed by our head of state that he will want us to actually target villages so that we ensure that every village has a safe drinking water source. So right now, within our monitoring framework, we are monitoring how many villages, the percentage of the villages in the country that have access to safe drinking water and sanitation services. Through that, we are trying to address this inequality so that you don't just go in a district and you think the coverage in the district represents everybody. We want now to be looking at the villages and see what is the percentage of the villages. And we do believe that the village brings the services closer to the people. Uganda was one of the countries that, one of the 6 countries actually that piloted SDG 6 indicator methodology. And within that arrangement, we're privileged to really analyze all the different targets and indicators. And when we completed the piloting exercise, we decided to update our sector performance measurement framework. So we have now added in the SDGs in our sector performance measurement framework. And specifically, we are trying to make sure that if the data we collect as we measure progress, it is disaggregated so that we see how we are providing services according to gender, for example, according to region, according to, say, disabilities and all of that. So we are doing that in that regard, and we are putting in place a baseline. We expect that by mid next year, we shall have a baseline, and we'll be reporting on this in September 2019 when we normally produce our annual sector performance reports. So we are on track. Everybody is convinced that we cannot just continue looking on without addressing the inequalities. We are moving on, but the challenge, of course, is enormous. As we collect the data, in some situations the data is not available, but also the effort we need to put in to collect this data is very big. But we are committed as a country to move forward. Within the country, we have also tried to address these issues within our national water policies. So our national water policy is undergoing review. We're actually finalizing it by January, and we have made a provision to take into consideration the human rights to water, and also ensuring that the country looks at water holistically so that you can provide these services in a holistic manner. This policy As I mentioned, will be approved by our cabinet probably by February, and we feel that it will have addressed all the issues related to water and sanitation services. Within the framework of water resources management, I think provision of water supply and sanitation services have great implication for water resources management. Obviously, you don't provide water unless it is available. So there are some situations where we don't have the water, and so providing this water becomes a challenge of how to move water from areas where it is in plenty to areas where it is limited. We also have to ensure that there is rational allocation so that one user doesn't take it all. We have been having, for example, hydropower developers wanting to take all the water, or even irrigators wanting to take water without considering the needs for drinking. And our national water policy is very clear that drinking water receives first priority. So within the framework of water resources management, we are putting in place a rigorous water allocation framework so that we provide water rationally, but also bearing in mind the need for sustainability. We are also, of course, as I mentioned,
1 minute.
we have also, as I mentioned, we are ensuring that we implement the programs within the framework of catchment, and within this framework, stakeholders' engagement is very key. We bring the stakeholders together, the private sector, the government agency, the civil society, the religious institutions, the cultural institutions, the academia, to work together, plan on how they are going to use this water. And through that, we do believe that the issues of inequality will be addressed, because we are bringing all these various stakeholders to come on the table and plan on how this water can be used for the benefit of everybody. Thank you very much.
Thank you very much, Kellis. That's a great country perspective, and you know, lots of things in there. You know, in terms of the inequality challenge, the big inequalities you spoke about in Uganda, even within quite small areas. Catchment protection, water resources management, linking up with micro irrigation, and so on and so forth. So lots of things in there. Thank you very much. We're now going to move on, I think, to the discussants. So let me introduce Chilufya. Chilufya, are you there? Can you hear me well?
Yes, I am.
Let me just introduce you first, just to remind people. So Chilufya is Regional Advocacy Manager for Water Aid in Southern Africa. Delighted she could join today, because she's going to rush off to a flight straight after. She has over 12 years experience leading civil society, pro-poor policy analysis and advocacy, and currently coordinating Water Aid's engagements with AMCOW, African Ministers' Council on Water, and a key role in supporting an improved focus within Water Aid country programming on reducing inequalities. So, Chilufya, you've heard two presentations so far. What do you make of them? What would you like to add or comment on?
Great, thank you very much. I think the first thing to say is congratulations to all the contributors to this book. It's quite a good effort, compiling all of the experiences from various angles. And listening to the two speak, I think that several things stand out for me. The first is reflecting on Kalis's input, as well as Tom's, is that we definitely need a holistic view to the problems that face us now in ensuring that everyone has access to water and sanitation. And so we have a big challenge ahead to meet the SDG targets. So this holistic view, beginning with policy, financing, catchment protection, and the role of people in ensuring that that access can be assured, is a key one. And that's what I'm hearing from the discussants. And I like those perspectives very much. What I would add is I think most of our countries need to do a little bit more in characterizing the problems, as well as understanding what are the major drivers of inequality, particularly in sub-Saharan Africa. the big problems we see, and Kalis referred a little bit to this, and as well as Tom, is sometimes really blanket responses to the problem. So if you speak about groundwater contamination, and if I use the example of Zambia, where I'm currently sitting, in Lusaka, the groundwater is being heavily contaminated by fecal waste because of the large number of urban slums, unplanned urban slums. And then up in the Copper Belt, a lot of the contamination is because of inorganic waste coming from the mines and other activities. So I think that the major drivers of inequalities in both of those locations need to be understood by our countries, and an investment in that diagnostic in every case is quite essential. So I like what I'm hearing from Uganda, and that focus at the local level, going below the district and not taking the statistics of one district as representing the situation in the entire district, but looking down at the village level, and in some cases necessary to understand what's happening at the household level. I think that there are also big issues around ensuring that access to water and sanitation becomes a central part of planning, budgeting, and reviews in our countries, with a focus on the key groups of people that are marginalized, that don't have access, that are not being reached. So there have been efforts in most of our countries to do joint sector reviews and other such processes, but we have missed the opportunity very often to focus in on what are the particular needs of the elderly, of women, or of urban poor and rural, because we are really constantly trying to understand why are we lagging behind, how do we catch up, how do we now get up to the SDGs, which is an important aspect, but I think we need to now be going a little bit further and saying who exactly is marginalized in each of our countries. So this question of context, but also why are they marginalized? Why are they not accessing water to the standard and quality that they should? And what should we be doing? So really interesting to see the statistics there that only 14 countries seem to be in the green. That means that the rest of our countries need to do a lot more in ensuring that planning, budgets, and reviews pay greater attention to the questions of inequality in access to sanitation as well as water. What that tells me is the need for greater decentralized governance. And I think Uganda Kalis gave some good examples from Uganda, where they are going beyond the district statistics and understanding what's happening below. But that means tailoring responses as well to the sub-district level, capacitating those structures that operate at that level to respond and have the skills to assess issues such as water quality, because those are some of the ones that we have significant problems with. Because the capacity simply doesn't exist in most of the countries. And I think when we look at the JMP statistics shared earlier, it also reminds me that there is a great need to improve the quality of data at the country level and also the sub-district level. So we have particular challenges regards to things like household water storage and treatment. And we have found, for instance, in Southern Africa, where we have, where I'm a lot more familiar, that women in particular, or let's say households, will collect water from a water source and it will be safe at source. But when it reaches the household, it is no longer safe because of the handling and all of those issues. So I think that there's definitely need for a holistic view to the problem, and a holistic approach to addressing those challenges, understanding that water and sanitation go closely together, as well as integrated water resource management, as earlier explained, and how we ensure that the choices about who accesses the water are well informed by the people that are usually marginalized. And this requires that we think about creating the spaces for participation in decision-making around how we ensure that inequality can be tackled and dismantled. So that means having women at the table, people with disabilities, and creating those spaces for them to speak about how we can ensure that they can access and that they are adequately served using the mechanisms that would be created in this decentralized governance structures that I spoke about. So I think I will end there and say that what I hear is quite some progressive suggestions and recommendations around how we can improve access, how we can try and tackle inequality in our countries, but I'm not hearing how we can ensure that governments that don't have the capacity are supported to get there. Thank you.
Thank you very much, Chilufya. Yeah, and that's a very weighty question you left us with at the end, especially if we want to sort of move up the service ladder to more expensive and more potentially more complicated things when governments are already struggling with basic service provision. I'm going to hand straight over now to Oliver Cumming. Let me give you a quick intro, Oliver. Assistant Professor of Environmental Health at London School of Hygiene and Tropical Medicine. As you heard at the beginning, one of the co-editors of this book on achieving equality and access to wash. So Oliver works on the epidemiology of water and sanitation related diseases, currently working on multiple trials to assess the impact of water and sanitation interventions on childhood enteric infection, undernutrition and oral vaccine failure in Africa and South Asia. I'm glad I got through that. That's quite good. Over to you.
Thank you. Good morning, everyone. It's a great pleasure to be here, it's really a great opportunity, I think, for both for Tom and myself and some of the other authors that are with us today to have the opportunity to discuss this book with you all, because it is a couple of years in the baking. As Roger said, just to put my cards on the table, I'm a public health researcher, and that obviously brings some particular biases. So I'm particularly interested in the contribution of research and evidence to the issue of equality, and I come at it very much from a public health angle. But what I would say is that equality is really at the heart of public health and epidemiology. Since the sort of 200 years since really here in London with William Farr, the use of public health statistics has always served as a tool to understand inequalities in health outcomes at a population level. I really just want to make three points, because I think the three previous speakers have done a really good job in terms of describing the book itself from Tom, but also then rooting some of the issues that the book touches upon in terms of sort of national and subnational issues. The first point that I wanted to flag was something which I really got out of this book and this experience, was going a little bit further in understanding the difference between equality and equity. And I was surprised. This was something of a controversial issue among the authors in the book. Some people felt very strongly that the book should be entitled Equity, or something along the lines of Achieving Equity. And other people felt very strongly that this book should be about achieving equality. In the end, we settled on equality, and the rationale for that was that I think we achieved a consensus across the authors of the book was that really equality is the end point, and equity is the means by which we arrive at equality. So you all may not agree with that. We might want to revisit it in the discussion. But that was the first point, which I certainly changed my mind, because I was one of the people who was pushing actually for using equity, because I felt this was a far more sort of progressive term. The second point I wanted to flag is around the conception and the contribution, at least as I see it, of this book to the sector at a policy level and at a practice level. And really the book tries to do a few things. The first thing is it tries to combine policy, practice, and research perspectives around this really, really important topic. So you'll see, actually, if you look at the chapters, many of them include both academic authors and authors who might describe themselves as operating in a policy domain or at a practice level. And I think everyone who contributed to the book felt that was really a very positive process, and caused many people, I think, to change or adapt their ideas. Certainly speaking as a researcher, we often have sort of wonderful ideas but can be somewhat disconnected from policy and practice realities. In the book, we try to describe where we are today in terms of the platforms and the opportunities for addressing inequality. So obviously the SDGs that Tom has talked about, the right to water and sanitation, and various initiatives at a regional and at a national level. The second thing the book tries to do is map out some of the key dimensions of inequality, and we touch on poverty, we touch on environmental insecurity, gender, disability, and indeed others. And then the third thing the book tries to do tentatively is suggest examples of where we have seen progress in addressing inequalities and ways in which we might in the future do better on inequality. So really, together, this presents something of I'd hesitate to say a tool book, but it certainly tries to answer some of those critical questions about, is there really an opportunity here to act? Do we know what we need to be doing? And do we have some idea as to how we can secure progress? I would really echo, though, just to conclude on this point, the previous comments from Zambia, which I think really apply to this book, that critically the next stage is to take something like this, which is a sort of global resource based on the global literature. But to take forward this issue, it needs to be grounded or internalized at a national level. Really, all of these issues, the opportunities, the key drivers of inequality, and what can be done about it are national questions which need to be rooted in national policy responses. And my sort of third and last point is a question, I think, to the audience, which is whether we should approach water, sanitation, hygiene, inequality as a symptom or as a solution. Tom picked up on this question about how there are multiple inequalities which interlock. They are co-distributed, they co-occur in the same populations. From a public health perspective, we sometimes use this term syndemics to describe the fact that we have multiple co-occurring disease epidemics. Yeah? The same people who are struggling with non-communicable disease, with heart disease, with cancers, are in many places the exact same populations who, at a different point in their life course, are struggling with a very high infectious disease burden. And if we simply try to understand one aspect of that, we will fail to address the underlying sort of structure of inequality. So just to close on that, I was in Senegal last week, where we're working with the Ministry of Health to design and test a wash package that will be integrated within the National Protocol for Treatment of Severe Acute Malnutrition. I wanted to give this just as an example of how negatively these overlapping inequalities can play out. So in Senegal, they've enjoyed significant success in putting in place a very strong protocol for addressing severe acute malnutrition, which particularly in some areas of the country remains a very important problem. Kids who are severe acute malnourished appear at a health facility. They're very quickly identified, and they're very quickly enrolled within a severe acute malnutrition outpatient treatment program, which includes provision of antibiotics, deworming medication, zinc, and they're then followed up weekly over an 8-week period. And generally about 50 to 60% of kids go on to recover within that period. What we see, however, is that kids who live in households with very poor environmental conditions, who have very poor access to water, sanitation, hygiene, are far less likely to respond to that package of treatment for severe acute malnutrition. And that really speaks to me to this fundamental issue that we cannot simply address single deprivations, such as improving healthcare access or improving access to therapeutic treatment for severe acute malnutrition. We also, at the same time, need to address other inequalities. In this example, water, sanitation, hygiene at home. So I think for me, the question I would sort of pose to the WASH sector, which I imagine most of us sort of are affiliated to, is how we do better on ensuring that lockstep, how we do better on ensuring that we move forward on multiple deprivations at the same time, because I think that's the only way that we're going to see significant differences. And just to say finally that I do think the stakes are very high in terms of addressing inequality, and I think I came from France yesterday and was late for my flight because I couldn't get on the plane because of the gilet jaune, and then arrive in London. I hear that there was huge demonstrations at the weekend, and I think fundamentally, whether it's here in the UK or in France or in the US, or indeed in, as we've heard, in sub-Saharan Africa and South Asia, we're really seeing at a political level the cost of not addressing inequalities. Right?
Yeah, great. Thanks, Oliver. So remember that question he posed to you, because we'll come back to that. Interested in whether you have any reflections. I've also keeping an eye. We've got a couple of questions coming in online. But without further ado, let me go over to my colleague here on my left, Dr. Eva Ludi, who currently manages the water policy program here at ODI, and covers a wide portfolio of work actually in ODI, not just in the water policy program, but in the climate change arena and environmental degradation, catchment management, the kind of thing that Caliste talked about, as well as WASH. So over to you, Eva, for your reflections.
Yep, thank you very much, and thanks everyone for coming, and the previous speakers. That was really, really interesting. And I picked up Caliste's mention of the natural resource management as being a core in Uganda's WASH delivery. And I think that is one of the sort of overlooked areas very often when WASH has been planned, that the status of the resources on which the systems rely was kind of assumed but never really looked at. And I think Roger mentioned as well the difficulty of having information, of having data, of actually knowing what amounts of water are available both above ground and below ground, but not only the quantities of water available above and below ground, but increasingly the quality of water. And what we haven't heard, and I was quite surprised, positively surprised, I haven't heard the word climate or change. So I'm not going to dwell on that, because I think in terms of WASH delivery, whether we are, it doesn't really make a lot of sense to be preoccupied by climate change by 2100 if we are still struggling to meet demand in 2018. So what will happen in the future is kind of dwarfed by the questions, how do we serve people currently, recognizing in particular the sort of spatial and temporal inequalities in distribution of water. And I think that's not part of the it's only part of the explanation of inequality to access, but definitely an important part to consider how resources are available, when they are available or not available, again, both above and below ground. And sort of going back a bit to research ODI has done recently in collaboration with the British Geological Survey and Addis Ababa University in Ethiopia, actually sort of over the last, I think almost 20 years probably now, shows very clearly how water availability and seasonality is kind of one of the sort of underlying factors of whether people have access to water services or not. And it came to a very sort of stark manifestation during the 2015-2016 El Nino drought, where parts of the country, especially in the north and the east, were completely, sort of people lost access to water completely. But what it also showed is that these are not areas that were particularly badly affected by the drought alone, but it was areas that struggle even in a normal year to access water for their daily needs. So what became very clear is that areas that already struggle because of a number of reasons, part of it is political neglect or, kind of clear sort of focusing on easy to reach areas versus much more difficult hydrogeologies to provide water. These areas were, of course, the ones that were hardest hit during the drought. And it was something like 9 million people in Ethiopia alone that were at the height of the drought water insecure, were dependent on water trucking. But again, a lot of areas are inaccessible in the Ethiopian highlands, and that meant that people had to migrate to areas where there was water. And that is a key problem in terms of how water resources are distributed, how people then have access to those resources, and whether they are affected or not. And these are big questions in terms of increasing access and increasing, sort of achieving the SDGs. And that also then relates to the question, what kind of solutions in a country like Ethiopia are available? If you are already in a difficult hydrogeology where people do not have easy access to, for example, groundwater, and it is an area with irregular and limited rainfalls where water harvesting is also problematic, how do you get water to people? And these will require a lot of more sort of high-tech solutions, expensive solutions, but will Ethiopia have the financial means to do so? Are multi-village systems that rely on reliable sources that bring water, convey water across, kind of ravines and gorges up and down mountains, is that the way forward in a mountainous country like Ethiopia? And Ethiopia is not the only one. So big questions how to provide that water to these people in such a difficult geography. And that then also kind of brings us back to some of the questions around allocation across different users and users, countries that are striving to kind of get to middle income status, whether that's Uganda, whether that is Ethiopia. There is a massive push for sort of industrialization, irrigation, large-scale irrigation, to produce either food for their own people or to produce goods such as sugar, which has a good value at the moment, or other sort of export crops. So a massive demand on water to go for the economic transformation process, because that is sort of where a lot of countries are aiming to. Now, what does that mean in terms of water for people in both rural and urban areas? How are these big questions around allocation being resolved? Who has a say at the table? It was mentioned we do need multi-stakeholder fora, but will those poor women, will the elderly, will disabled people really be included in these questions around allocation? Or will we not end up again in a situation where the powerful kind of have the voice, they can sort of make sure that the policy decisions are skewed in favor of their needs and not the needs of the people without the voice, and even the ones completely without the voice, environmental needs, which are key to be able to, in the future, provide the services. And if they are not taken into account at the moment, we will have massive issues and difficulties in future if we don't figure out how to ensure those environmental services over time.
Thanks, Eva. Thanks for emphasising the, some of the difficult questions that higher levels of service provision pose in terms of trade-offs and competition between different uses and users, different scales, something that, of course, Caliste brought up. Right, now I think we should go straight into the Q&A. At the end, I'll give the panelists 1 minute each just to sum up their thoughts from the day. But let's go over to your questions. We've got some good ones coming in online. Keep those coming. I'll try and weave them in as we go along. But let's start here in London. We've got a couple of people with microphones. So if you've got a question, keep it short and neat. And tell us first, who you are and where you're from. And we'll take 2 or 3 at a time. So let's go first over to the back.
Hello, good morning. My name's Henry Northover. I'm from WaterAid. Thank you very much for a really interesting set of presentations. I just wondered if I could ask the panelists to invite their reflections on this issue about the overlapping, interlocking nature of inequalities with broader dimensions. And if I was to ask you to reflect on maybe just 1 or perhaps 2 policies within the WASH sector that are going to tackle inequality in distribution of water and sanitation services, and maybe perhaps also outside of the WASH sector, what would be your favourite policy responses in terms of tackling those that interlocking and overlapping nature of inequality in WASH services?
Thanks, Henry. Let's take another one. So we have a call here for some practical suggestions in terms of addressing this sort of issue of multiple deprivations that we've heard about here. Let's go over here. I haven't forgotten.
Thank you.
person
I'm Michael Tudor. I work for PumpAid, very small NGO working mostly in Malawi. Not only did no one mention climate change, no one also mentioned functionality. And while Malawi proudly boasted that it achieved its MDGs and had 81% of its population with access to water, WaterAid actually did a survey on behalf of DFID and discovered that functionality rates in rural Malawi were between 60 and 70%. And if you apply that to Malawi's 81% access, it actually drops to 57. To what degree did we actually achieve the Millennium Development Goals?
Okay. Good. The functionality word has come up. Thank you for doing that, because of course target setting is all very well, but you've got to keep your existing infrastructure and services going, and we know that that's a massive problem. So let's take those 2 first, I think. Caliste, let's bring you in terms of, because you're working at the coalface in Uganda. Let's take the question on the practical policy responses from your side that you see as really having an impact on these multiple deprivations that we've heard about. What are you doing to address inequality in Uganda, and does it go beyond just WASH?
Thank you very much, Roger, and thanks to the person who raised the question, I think Henry from WaterAid. For Uganda, we have, of course, recognized that when you look at water, we have traditionally looked at water for just drinking. But as I think Eva mentioned, as we try to move into middle-income status, we are trying to progress on different fronts, and water is becoming very key in this regard. Micro irrigation, industrialization. Right now in the country, we are going in for oil and gas development and all of that. So we cannot just look at WASH in isolation. So one of the policy responses as a country has been to employ a catchment-based approach, planning, development, and management of water and related resources. So when we go in the catchment, we are trying to look at how much water do we have overall, underground water, groundwater. What are the demands, the current and future demands, and how do we respond to these demands in a holistic manner? But at the heart of that are the stakeholders. We are creating stakeholder coordination and engagement structures from the village level up to the national level so that they can provide inputs into what we are trying to do. And we are seeing good responses. We're already here leveraging capacities and resources, and we do believe that we are creating platforms for people to engage and bring in things that traditionally have not been discussed. But still, it's infancy, but it has promised to help us address these inequalities. Thank you.
Callista, I mean, this may be something you want to come back to again, Oliver, in a moment. But let's, Chilufya, what is your response to this question about the best way, the practical way, your experience in WaterAid of addressing these interlocking inequalities? And just if you can, pick up this question on functionality. I mean, how do you see things from a Southern African perspective?
Yeah, thank you very much. I think both of those were really good questions. So from this question, from the overlapping, the question around multiple overlaps to inequality. So if you will allow me to use an example from Zambia, or let's say Lusaka. So Zambia is landlocked. We have lots of rivers, but Lusaka, the capital, doesn't sit on a lot of groundwater. So we rely a lot on no surface water, but groundwater. It's urbanizing very fast. So you have people living in slum areas that have close to no income to access or pay for water. So they're digging shallow wells. What we have seen in the last 6 months to a year has been enormous outbreaks of cholera because the city has maybe 14% coverage in terms of sewer. The rest of it is on-site sanitation, which is not properly managed. So you have a massive contamination of underground water. And a lot of that is happening in the urban slums where the majority of the poor live. So there's a whole range of inequality going on there, income, geographic, etc. And the cholera burden in these locations has meant that people have lost incomes even more. They have lost children and families, of course, breadwinners, etc. The government's response, I know Henry asked for what policy response might be my favorite. The one I will refer to is not particularly my favorite, but I think it's a start in terms of saying we have to look at the various things that affect people and drive inequality further among given populations and respond appropriately. So the government of Zambia's response was to try and regulate groundwater abstraction by introducing something of a levy on anyone that drills boreholes in the city to minimize the abstraction of groundwater. Number one, it wasn't particularly my favorite because it was introduced in much more of a as a punitive measure to minimize the extent to which private households and operators were abstracting groundwater, but failed to do the thing that we were speaking about earlier, look at the problem holistically, understand the various layers of inequalities that people are facing as a result of the limited water available in the city and the limited nature to which government has responded so far in ensuring that that access is made available. So that regulating of groundwater abstraction did one thing, but didn't address the problem as indeed we saw the cholera outbreak only months after that policy was passed. So I think my favorite policy would be one that took into account more proactively the issues around how do we manage our water, service and ground, how do we ensure that people have access where they are sitting, in ways that are equitable? How do we ensure that the needs of each part of society are understood and that they are addressed, but also anticipating those needs, particularly in urban locations like Lusaka that I've used as an example, where population is growing rapidly and it's unplanned, but factoring in as well city plans that can address that aspect of needing to be proactive. So that would be my favorite policy, Henry, but unfortunately I can't say that one exists at the moment that I could that I could point to. In terms of functionality, that's
Chilufya, let me just
sorry.
let me just stop you there for a moment, because
Yeah.
because I want to bring some other people into the discussion. Also, in particular, a couple of questions we've got online. So I'm going to park you for the moment, because I want to bring some of the panelists here in as well. We've got a couple of questions that, you know, are obviously about the inequality thing, but I mean, maybe for you, Tom, you know, could aiming for the safely managed target, that aspirational target, which is, you know, on plot supply, to take the drinking water one, actually pull money away from the provision of basic services? So the perverse effect is to increase inequalities, not to reduce them. Any thoughts on that? That one coming from one of our online contributors.
Yeah, I think it's a very good question. I mean, something which I think is interesting is, you know, the SDGs came from a more kind of hopeful time, and have a very strong focus on inequalities and recognise that inequality is a structural issue and requires a transformative change in existing relationships. So the kind of logic behind them was that these aspirational global targets would then be localised, and individual countries would set their own targets according to, you know, whatever is the local context, locally available resources, and implicitly priorities. And I think what we've seen, so, you know, very often when we do missions to have these discussions with governments on the ground, the conversation is, well, what is your situation for open defecation? You know, what remains to be done? Then where are we on basic services? And it's very rare, actually, that we get onto the safely managed component in many countries, because there's still such a huge amount of work to do on achieving basic services. But at the same time, if we don't think ahead to drinking water quality and safe management of excreta, then we could well be storing up problems for the future. So I think even if it's not realistically achievable to get drinking water on premises for the entire population, we should be thinking about, well, what is the target, and for which populations and by when, and how does that then relate to other targets that we have for basic services that go beyond WASH. So just to pick up on Henry's point, which I think is very interesting, clearly there's a kind of a coordination in space and time issue in terms of the way in which different sectors work together, but there's also, I think, a sequencing issue. And we have now gone beyond monitoring WASH at the household level, and we're starting to look at WASH in schools and WASH in healthcare facilities and workplaces. And here we're seeing really quite shockingly low levels of coverage. And it raises the question, you know, how do you expect to achieve improvements in educational outcomes? How do you expect to achieve improvements in health outcomes if you don't have the basic preventative health measures in place in the healthcare facility where your wife is trying to give birth? And I think these are also really important questions about the sort of interlocking nature of these inequalities. Yeah. Thinking about, you know, getting the basics in place, whether it's at the household level or in institutions, in order to provide that foundational platform to then move on and achieve more ambitious things.
And what about, I mean, just very briefly, Tom, this issue, I mean, so it was something that Chilufya brought up. Plans, budgets and joint sector reviews should address inequality. So, you know, this idea of sort of mainstreaming it into the formal processes Is that something UNICEF is promoting? This was one of our online questions.
Yeah, very much. I mean, I think that in many countries you have an existing platform, a joint sector review, that brings together the stakeholders, whether they're government or donors or NGOs and others. I think that's a great starting point to discuss the targets, and ideally not just what is your target for different services, but do you have an explicit target to reduce inequalities, which is much rarer in a lot of these situations. But I think, as Chilufya was highlighting, you need to then go beyond that, because there are individuals and groups who are very unlikely to be part of that discussion. And so you have to think about a different mechanism in order to bring them in. This idea of a participatory review, which would help to identify those disadvantaged groups that are not appearing in your national statistics, but everybody knows are disadvantaged, and then figuring out a way in which to bring them into the discussion, to have a conversation about how we address their needs, whether they're women and girls, people living with disabilities, indigenous groups. I mean, these are highly context-specific types of conversations that need to happen. And very often those would be outside of the formal joint sector review process. So we think we need to have a bit of both.
Yeah, all right, fantastic. Now, over to our audience again. Yes, this gentleman over here, we missed you out earlier. Before you kick off, anything over from this side of the room? Any questions? You're dying to get out as the clock ticks. Oh, no. No? Okay, well, let's stick to this one yet, and
Thank you.
Possibly add one of my own. So who are you?
I'm Tim Hayward from What's Up. I think my question is aimed mainly at, I guess, towards Tom, or it'd be interesting to hear your response, that the JMP statistics, as they are often discussed and quoted, actually hide the real nature of the crisis. And I'm referring to the split between rural and urban, and it's very easy, and you put the figures yourself up on the screen, which showed that generally urban coverage is much, much better than rural. But the direction of travel here is, we all know that the population of Africa is set to double in the next 30 years, but actually the urban population will triple and the rural population will stay the same. So when you add on top of that the huge inequality there is within the urban areas, that a city like Nairobi, half of the population live in the slums, and that there's a massive difference in between the levels of service available, for the middle and upper income consumers as compared to those living in the slums. That those simple statistics hide the fact that where the real crisis is in the low income, informal areas, not just of the big cities, but the small towns and the rural developing towns.
Why don't we pick that one up? I mean, maybe Oliver, you would like to come to that, because this is a big public health issue. Densely populated urban areas, informal settlements, very little waste, safely managed, disposed of, treated, whatever. Mixing with drinking water, groundwater as a source of drinking water, self-supply, and a receptor of waste. It's and these very rapidly growing smaller towns where urban growth is focused predominantly. What are your thoughts on that?
So I have some thoughts on this, which I'll share. But maybe you want to put the JMP on the spot, but maybe you can come back to that. One thing I would say is there's a chapter here that was led by Gordon McGranahan with sort of various of his colleagues from Tanzania, called "How International Water and Sanitation Monitoring Fails Deprived Urban Dwellers." And I think that chapter is very interesting, because it makes exactly this point, that the impression that sometimes is taken away from the joint monitoring programme, not one that I would argue the joint monitoring programme itself projects, but one of the messages which is taken away is that we're doing much, much better in urban than we are in rural. And in fact, as you've said, looking forward, the problems are likely to only get worse. But I would also say that the problems as they currently stand are not per se much better than rural, because the statistics that we're comparing suggest that needs are equal. between low-density rural areas and high-density urban areas. So I would argue that the importance of safe excreta management in an informal settlement with a population density of over 50,000 people per square kilometre is much, much more important, plausibly, than an area where population density could be 100, or let's say, below 10,000 people per square kilometre. And that's logical and plausible. The one thing which I would flag from a public health perspective is that 20 years ago, in terms of global health, the global health literature, it was very clear that an individual's prospects living in a low-income country, urban area, were much better than their counterparts living in rural areas. So generally, people who were living in urban areas had sort of better, higher income, better access to education, better access to healthcare. Those statistics are changing, and if you use the lens, for example, of undernutrition, we're starting to see very startling levels of undernutrition and infectious disease burden in urban areas where traditionally we didn't. And this is somewhat reminiscent, for me at least, of the development story in many high-income countries where initially that first wave of urbanization was actually associated with a huge decline in public health, because moving to the urban environment was very much a trade-off between improved economic opportunities but much diminished public health status. So I think, sort of in summary, Pim, I think this is really, really important. I think the JMP actually does provide us useful statistics that allow us to start thinking about this. The fact that we see stagnation in many low middle income countries in terms of coverage, so it's not changing because we're unable, as I think Tom said, to manage this huge sort of migration to urban areas. But from a public or environmental health perspective, I would say the need is often greater in these populations. So we certainly, to answer the other question about safely managed and creating disincentives for progress on basic, we absolutely, in an urban environment, do need to be talking about safely managed sanitation, because frankly, many basic sanitation technologies are unlikely to be safe from a public health perspective in those environments.
Yeah, thanks. Now, before I bring in Eva, perhaps, and also Chilufya, any questions from our audience here? I'm also scanning online. I know we've got a couple more. Nope. In which case, let me have a look at some of these online questions. I mean, we have one on financing, not surprisingly, and I know there are a couple of chapters in the book that deal with this. The cost implications in kind of aggregate terms of the ambition, but as the big questions around, well, who's going to pay? What's the distribution of payment? What does it look like between tariffs and subsidies and taxes and so on? So let's go to, Chilufya, in your advocacy work here, what kind of conversations are you having with government about this, on the financing question?
Great, thank you very much. So I think, that's the one conversation we want to have quite frequently, because financing is an essential tool for implementing the kinds of things that we would like to see implemented to tackle inequality as well as improved access. So the things we are discussing, number one is that we are saying we would like to see that governments set aside their own money initially to finance access to water and sanitation, and where aid is available, that it should be applied and used appropriately. And the third thing is increasing the capacity to absorb the resources that are made available. So the majority of the time we find that water and sanitation budgets do not increase. And the basic argument is, well, the sector ministries are not able to absorb the money anyway. So how can that be when we have so many people not accessing water and sanitation to the level we would like, that budgets are not being absorbed? So it's a big question around capacity. Do we have the right level of resources in the places where it should be, so that when the financing is available, that it can be absorbed? But even with that said, we still do need a lot more investment from governments, as well as governments thinking about innovative ways to tap into private sector money, as well as other sources of financing, to ensure that we can meet the gap, because the gaps are quite huge.
Let's also hear about that from Caliste. I mean, how do those conversations go in Uganda? Are you lobbying hard for extra money to try and meet SDG aspirations? Are you know, is the conversation changing, or do you just have to take what you get in a water ministry that plays second fiddle to some of the more powerful ones? How is it?
Oh, thank you very much. Certainly, these discussions are ongoing because we see coverage not increasing substantially every year. So we are again lobbying government to put in more money. But one of the challenges, of course, we have been faced with is there are many demands on government resources. So we are being challenged to justify how important we are. The contribution of water, sanitation, and hygiene services to the growth of the country, to the economy. In Uganda, we did, last year, we did a study, an economic study. We tried to quantify the economic contribution of water and environmental services to the economy. And we noted that if government invests in water and environment services, the economy would be able to grow by about 9%. Also noted that contribution, about 51%, would come from provision of water and sanitation services, while 49% would come from management of water and environmental resources. So right now we are talking about numbers, and the Ministry of Finance is listening. I think one of the things we have not done, and I think which we need to focus on, is we need to talk about numbers. Sometimes we think we are important, but many other sectors are equally important. And we are being told, can you clearly justify to an economist, to a politician, how important you are? And if you don't get funds, what will happen to the growth of the country? So we are doing that. We are also looking at innovative financing sources. We are looking at funding from the private sector. We are also trying really to leverage resources from also the civil society and have these integrated approaches to deliver of services. We do believe that we can save a lot of money by working together. We see a lot of duplication. An NGO is doing work here, government is doing work here, another government ministry is doing work here. So we are trying to integrate our planning so that we can leverage the available resources and do more with what we have.
Thanks, Caliste. Now, before I bring Eva in, I keep saying that, I'm not leaving you out, but yeah, we have a question over here on the left, if we can get a microphone. So just tell us who you are and where you're from, and then off you go.
Hi, thank you for that. My name is Priya, and I'm also from WaterAid. My question is on disaggregation of the data to understand more of actually who is missing out and for what reasons and what their shared characteristics are. Dr. Caliste said that in Uganda they're aiming by mid-2019 to have a baseline, and I wonder what the challenges are that they are experiencing in actually disaggregating that data and getting real quality information and consistent across the country. And maybe also to Tom, what are the biggest challenges we're facing in the wash sector globally in getting this disaggregated data, and what do we need to do more of in order to have it of sufficient quality?
Thank you. Now, before Caliste, that may be something you want to just put in your head to come back to when I give all the panelists your 1 minute final fling, if you like. Tom also. I just think we've probably got time for into the orange zone here on the monitor over there. So we've got a couple of minutes to play. Let's just see if we've got another question from the audience here. No, okay. Let me just check on here. But I am going to go back to you, Eva. Let me just park that for the moment. Integrated approaches, Eva. We've done a lot of work on trying to, sort of break down the silos a little bit, and so that wash delivery also considers issues of wider catchment management, the kind of things that Caliste spoke about in Uganda. But people like you and I are always banging on about integrated approaches and holistic this and so on and so forth. Drawing on your rich experience, how do you convince people that it's worth doing? Maybe there's a lesson here from Caliste. He put dollar signs on wash outcomes. Is that where we should? Do we still need to be doing that?
Yes, I think we still need to be doing that. And even though the business case for WASH is kind of made, we do know what roughly the costs are of a lost life, what the costs are of someone being ill, what it means in terms of lost ability to earn an income because care responsibility. So in a way, these costings have been made, but probably they have stayed too much within the sector or too much within the academic world, and still not out there in kind of in force and not known by the ones who actually make the decisions. I'm sure within the Ministry of Water that is responsible for planning WASH, the numbers are known. Within the health sector, the numbers are known. But within the Ministry of Finance and Economic Development, do the people who really make the decisions have access to that information and know what it costs to be ill, what it costs to not have access to water for either domestic or productive use at the household level, what it means if you live in a slum and don't have access to sanitation and hygiene. So I think we need to raise the profile, not within the sector, because the sector knows the issues, also not within sort of neighbouring sectors such as health, but we need to go and convince the Ministry of Economic Development and Finance about the importance of water, but not just water supply and sanitation, but also what it means in terms of managing the resources on which that water depends, and then conversely, sort of flip side of the cone, managing the pollution which comes part from the domestic side, but increasingly in Africa and in Asia, from the industrial side and the agriculture side, that then undermines the ability to provide safe water. So we need that integrated approach, and for that we need to go to the highest level, and that is Ministry of Finance, Ministry of Economic Development, Prime Minister's Office, to make the point.
Thanks, Eva. Yeah, something we've tried to do on occasion. Right, I'm going to go back to. Thank you for those questions, and thank you those online. Sorry we didn't manage to cover all of them. I'm trying to get the balance right here, but many thanks for contributing. I'm going to go to each in the order we started. So I'm going to start with Tom, and maybe you'd like to squeeze in to address Priya. Was it Priya? Priya's question in your 1 minute. Give us a thought or two thoughts as we go round the panelists. 1 minute each. Over to you, Tom.
Okay, that's quite a challenge in 1 minute, Roger. But as I said, I think there's a need to localize these targets and to ground them in local context. And while we're clear that the benefits of investing in WASH outweigh the costs in almost all cases, as clearly illustrated, there are some real choices to be made about where you invest, how you invest, Are you investing in sewer systems or on-site sanitation systems? And who is going to pay for those? Are they primarily coming from government or coming from the users, or some progressive form of cross-subsidy, which I think is a really important national level conversation, and the answers will be different. There's no blueprint. But there should be built into those some explicit targets for reducing inequality. It should be possible to say not only, the rising tide will lift all boats, but that we will at the same time seek to reduce inequalities, whether they're rural urban or within urban or other types of inequalities. And one of the things you need there is good data. So as Priya said, there's a lot of work to do still to collect high quality data, disaggregated data on the resource base. We don't know nearly enough about the resource base, as Roger's pointed out in his chapter, but also on service levels. And once we get into inequalities in service levels, we start to see some really interesting pictures. It's no longer the old rural-urban divide. There's lots of complexity within that. But the last point that I really want to emphasize, coming back to something that Chilufya mentioned, I think, is this concept of a participatory review, which will look different in each context, but it seems to me to be very important in order to get beyond whatever data you have in the national data system, which is ultimately what we use for global monitoring, and to start to drill down and understand those groups who are too small to appear in the national statistics and the global statistics, but ultimately are going to need to be a major focus if we're going to achieve universal access in the next 15 years.
Thanks, Tom. I'm going to go, Caliste, now. You've got your 1 minute. Final thoughts.
Okay, thank you very much, Roger. My final thought really is SDGs are providing us a big opportunity to address issues of inequality. I think for the first time we're having an agenda that has been determined at the highest level possible, so we have all the support that is needed. But also requires work to be done at the lowest level, and the engagement of all the different players is key. Our piloting of the SDG 6 indicators noted that you can actually leverage capacities and resources by bringing the non-traditional stakeholders on the table. They have a lot of wealth of knowledge. They even have some of the data we think is not available. Of course, the quality of the data is one thing, but sometimes you may not know that data is available unless you open up space to the others. So we need stakeholder coordination and participation frameworks so that the civil society, the cultural institutions, the religious institutions, academia, government agencies, private sector talk together, and this has to be from the lowest level up to the highest level, and through that we'll be able to communicate beyond the water sector. And I think, as Eva mentioned, we have talked for long to ourselves. We need to talk to the others outside the sector. Thank you very much.
Thank you, Caliste. And Chilufya, you're still there, haven't rushed off to your plane yet. I don't want to make you miss your plane, but, here's your minute, your turn. What are your final thoughts?
Thank you. So I maybe two final thoughts. The one related to the question on functionality, because I think it's an important indicator of sustainability of the services that we are speaking about. I think the indicators around functionality and the poor performance of the sector up to this point are really good reminders for us to think about the nature and quality of the service delivery that is currently available. Is it of a standard that a person who might be a woman, elderly, but also disabled can access? Does it have the ability to last for a good enough time for the community to actually benefit and not become a burden? So all the questions around the technologies that are being selected, are they looking into the future and understanding the growth of particular communities and the needs as they shift and so on? But there's also a big piece around monitoring that functionality as an indication of how sustainable access will be into the future. And so at WaterAid, we have done a few things like support water point mapping to understand who is accessing what, where, when does it break down, how quickly, what is the response time, and those sorts of things. And I know that many other actors are supporting those kinds of efforts. Increasingly, the same kinds of things being used for sanitation facilities as well. How do we know how many sanitation facilities are available? When are they functional? When do they need repair, and who is responsible? So I think those are key tools available to us that we should keep building on to ensure equitable access and that people are actually served when they need to. The last point for me is that in sub-Saharan Africa, the big narrative of growth now is around ensuring we have economic growth. And somewhere in there will be your human development. So I think that the good thing is that we know that access to water, as well as sanitation, sits squarely in the economic development and human development discussion. And so you can't ignore it in both of those. And it gives us a real good opportunity to engage quite proactively in ways that will enable us meet the sustainable development goals, bringing all actors along, whether they be business or governments or individuals, because they can see themselves in that whole discourse. Thank you.
Thank you, Chilufya. And if you need to rush off, then do go. If you can stay around for a minute or two, then please. Oliver, your 1 minute.
Okay. Yeah, so 3 points. I would say limit ambition at your peril. There's been a discussion we've touched on here about whether the SDG is the safely managed is too ambitious. I think there are huge risks in trying to reduce the level of ambition at the international level. Secondly, I think which I think speaks to Priya's point, the data with accountability mechanisms is really, really important, and it doesn't cost a great deal. Simple disaggregation of data can be very powerful. I'm still struck that the JMP's disaggregation by wealth quintile and their comparison between India and Bangladesh 10 years ago, 10, 15 years ago, had such a powerful impact in the way that people viewed the JMP data and the differences that were sort of laid bare between countries. So I do think we can do a lot with simple data and holding people's feet to the fire on that. My last point, which I think picks up on this issue about growth being not just in Africa, but in many parts of the world, the sort of key political agenda. And although it pains me to say this, because I'd like to believe that public health would be the best way to make the case for these investments. But I think one thing we can learn from the discipline of economics is the value of the human capital argument. If governments are ambitious and committed to a growth agenda, you cannot achieve economic growth without investing in people and in your human capital. Ultimately, that is what drives economies forward. And water, sanitation, hygiene, as we are increasingly aware through new evidence, impacts profoundly on human capital through traditional health outcomes, but also in terms of growth and development, even cognitive development, and then future economic productivity. So I would make a case for human capital.
Yeah, and growth that benefits everyone, not just small sections, a big topic here at ODI. Eva?
Yeah, I think the last decade has been sort of the decade where everyone was talking about resilience. And I think we need to move on and come back to actually a very old concept, sustainability. And that kind of speaks a little bit to what you just said, Oliver, in terms of growth, but what kind of growth? We need to have growth that makes sense environmentally. If we need to preserve the resources, we have to provide the services we depend on. But we also need to achieve a growth path that is socially acceptable and equitable. And I think going back to the old concept of sustainability unearths some of the thinking from the 80s and 90s around how do we define sustainability? Who is or who are the people who define what a sustainable path is to transform, to change, to achieve a goal, would kind of help us quite a bit in finding some of those balances which we need to find in future, because the demands get larger. The supply kind of largely remains the same when it comes to natural resources. There is a huge untapped gap in terms of human capital, definitely, but we need to kind of revisit some of the thinking and political sort of capital of the sustainability debate when it comes to the SDGs.
Thanks, Eva. Right, well, and thank you to the audio-visual people here for letting us run slightly over, but it was a good discussion, and I didn't want to cut too many people off, but we had a lot of contributors, some good questions. So to wrap up, I mean, first, just to thank the panel members, Tom, Oliver, Eva here in London, but also, of course, those joining from far-flung places. So Caliste and Chilufya, thank you very much for joining and for your great contributions. Obviously, thank you for the audience, both here in London and joining online. We got some great questions. I think we have the book looks like this. Fantastic Christmas present. I shall certainly be buying one for my wife, which would be absolutely delighted. But look, let me just stop by saying thank you for all thank you for coming, and if you're going to have a holiday in the next few weeks, then I hope it's a good one. Thank you, everyone.